Yeah, you can go ahead.
Namaskar. Good morning, everyone. So good to see so many of you join us today. Some after a long time, some for the first time. Welcome, one and all. We have lined up an excellent presentation on taking care of our digestive system today. Today's event is organized by the Ontario Konkani Association. We thank the executive committee of OKA for their continued support. It gives me a great pleasure inviting the president of OKA, Surekha Shenoy, to bring greetings from OKA. Surekha?
Thank you, Sadanand. I hope everyone had their clocks set forward because I know you guys are joining us losing 1 hour of sleep. So thank you, first of all, and good morning. I know you're looking forward to this important conversation of health awareness by Akshata. Today, it's important to be aware of the impact of our actions, be it on our body through what we eat or on climate change. By raising awareness through education, we can bring about that change. To this extent, I want to thank Sadanand and his team who selflessly give their time to our community in bringing these important sessions to us. We are grateful for all your work, Sadanand. I'm sure you're not happy with the numerous emails you got from me in the last 24 hours, and my apologies. It was not my intent to inundate your inbox with emails. However, I had to keep them separate as each had its own urgency, and I didn't want the message to be lost in a long email. Regarding the NACA email, that is the North American Konkani Association, our umbrella organization, we work closely with them and we want to make sure that we are part of the conversation. To this extent, we got an email about the general elections that they're having. If you are interested, anyone who is interested in applying for any of the positions, please use the links provided in the email to apply for the position or submit your nomination. Please be aware of the deadline for receiving nominations is March 28th. I encourage you to step forward if you're interested. And none other than Sadanand is our chairman of the NACA Elections Board. I don't know how many things he's involved in, but I'm amazed at the energy he has. As always, OKA is also looking to fill positions for the coming year. If you're interested to serve our community, I do know there are many of you who can do that. Please reach out to me. We would be grateful for your support. I also sent an email on our upcoming Yugadi function, New Year, New Hopes, virtual event on April 17th. If you or your family member is interested in performing at the event, please use the Google Docs in the email that I had sent to enter the details. Alternatively, you can always reach me or our entertainment coordinator, Neha Malya. We are hoping to focus this event on our Konkani culture. Please do not forget to visit our website for information on Konkani classes under Gurukul or utilize Sangam if you're looking for alliances for your children or if your child wants to meet a Konkani partner. The Sangam matrimonial is only for eligible Konkanis in North America. Lastly, please be aware of COVID vaccination clinics that are open in your area and are vaccinating anyone 80 years or older. You do have to register. Please use one of the links I sent yesterday if you live in one of those areas. Alternatively, please visit your public health services website for the registration link. I know you're all waiting for Akshata to speak. Could I ask all to please mute yourself as we want to make sure Akshata can be heard. Also, if you have any questions through the presentation of Akshata's, please type your questions in the chat box. We will ask them at the end. Thank you for your cooperation, and over to you, Sadanand.
Thank you, Surekha. Especially great greetings, especially peppered with kind words for all of us. Excellent, well done. A few months back, both Suvarna and I had an opportunity of attending an information session presented by our speaker, Akshata Nayak. We were so impressed with her presentation that we contacted her immediately to ask her whether she would give the same presentation to our group. She readily agreed. and here we are. Akshata is from Vermont, USA. She has earned 2 Masters of Science degrees, one in applied clinical nutrition and the other one in biochemistry. She is an applied clinical nutritionist at the Alternative Roots Welfare Center in Vermont. She loves to share her knowledge and experience. So over to you, Akshata.
Hi, everybody, and thank you so much for having me today. Very nice to meet another group of another Konkani association. I'd been working with the California one for a while, so it's nice to meet all of you now. I will just try and share my screen. I know that I'm a bit backlit today. I just didn't get a chance to get the lamps in front of me in time, so I'm trying to hide the sunlight and hopefully I'm not looking too dark, but most of you will be looking at my presentation for the rest of the talk, so it should be okay. So I hope you can all see this. Let me just put
Yes,
that.
we can.
Okay, great. So then I'll get started.
Please.
That's right.
Okay. Okay. So hi, everyone, and thank you for that introduction. My name is Akshata Nayak, as Mr. Sadanand just introduced me. I live in Vermont, and I work at Alternative Roots Wellness Center, which my husband and I run. He's a chiropractor, and we're both clinical nutritionists. So clearly, we've been in school way too long. And one of the things we like to do because of that is just share all the information that we've learned in school, as well as in about little over a decade of practice that we've been in Vermont. This is one of the topics that I like to talk about because it is something that I seem to talk with my patients on a very regular basis. Knowing what your digestive system is all about, what happens, what can go wrong, and how you can take care of it is, I think, a very important thing to do. So we'll just get started and I'll go over why. So why is your digestive health so important? I think it is I like talking about this topic for 2 reasons. One is that there are more people who have digestive issues than you really think. And the people who have it a lot of them tend to brush it off as just annoyances rather than trying to figure out what is going on and understanding the impact that it might be having on your overall health. So because of these 2 reasons and that the awareness isn't really there as much as it needs to be, that's the reason I like talking about this topic. Another reason is also that there is such a close link between your digestive health and your overall health. This is something that I truly believed in when I started my Master of Science in Applied Clinical Nutrition. In fact, I did that because of multiple health issues that I was experiencing myself. And I realized how my digestive system was playing a role in that. And now over the past, I would say 15 years or so, there has been an incredible amount of research that does support this idea that there is a very strong link between your digestive health as well as your mental and physical health. So most people might understand more easily the link between your digestive health and your physical health, because I think overall you can physically feel sick when you're not feeling that great when you eat food or you have all of these symptoms. But what I tend to talk to my patients more about, it turns out, is this link between digestive health and mental health. Especially if you have concerns like anxiety and depression, it is important to understand the role that your digestive system is playing and seeing how changing your diet and your lifestyle can really help support whatever treatment plans you're working on with your doctor, your therapist, or any other healthcare practitioner that you might be working with. So this is something that I tend to talk about a lot, and it's very important to me. Understanding digestive health, I truly believe that if you want to know where something is going wrong, you need to know what that something is, rather than just trying to find a band-aid approach. If something goes wrong with your house, if you have a leak, you won't just paint over it. You'll find out where the leak is and try and fix that. So I really think that we need to approach our health in the same way. And so trying to understand what can or where things can go wrong in digestion, it's important to understand what your digestive process looks like. So this is going to be a little bit of an anatomy class, and I will try to keep it as simple as I can. If you do have questions, I will happily, go into more detail about it. The other thing I want to talk about is that as I'm going through the process of digestion, I will highlight the most common concerns that people come to me with. This is by no means a full list of issues you can have with your digestive system. Clearly, there can be textbooks written about just this one thing, but it's just the most common concerns that people approach me for. So if you have anything specific you want to talk to me about, you're more than welcome to reach out. I've also included my email in this presentation. So if you don't want to have the conversation now, if you want to have a personal conversation, we can do that by email as well. You don't have to be a client to ask us questions, but if you're interested in a nutrition consult, we do those online and those are available also. So starting out with the process of digestion, we will try and keep this simple, like I said. You have to think of your digestive system as a tube. You have two openings, one on the top, one on the bottom, and then your food moves through it in different stages. And each stage is very important. When you eat food, your teeth come into play. They help you break things down, tear things apart, and then your tongue helps you push everything back down into your throat. Now, after this step, everything is involuntary. You don't have to sit down and think about these different steps of digestion consciously. It happens on its own. However, what that means is that there are many messengers that come into play here. So you have hormones, you have neurotransmitters, which are messengers from your nervous system. You have enzymes, you have all of these digestive factors that come into play, which tells your body, step one is done, time to move on to step two. Step two is done, time to move on to step three. So if anything happens to these messengers or they can't get the message on time, you can have blockages or you can have bottlenecks at that point in your digestive system. So that's where things can start really accumulating. So once you move your food down your throat, it goes down into your stomach. And the most important thing that happens here is that it mixes in with stomach acid, and then from there, it moves on into the small intestine. Right at the beginning of the small intestine, you have your pancreas, your liver, and your gallbladder that sort of dump all their juices in there. So all the food can mix up with it. These are full of enzymes and other factors that are required for digestion. So it really helps break everything down so that as that food now moves through your small and then your large intestine, most of this the nutrition, the vitamins, the minerals, the water, all of it can get absorbed into your body, and whatever is left gets excreted as waste. So this is basically the process of digestion. Now I'll be going through each one of these steps in a bit more detail so we can talk about it. Again, if you have any questions about anything specific, just let me know. So starting out with your mouth, you have to chew well. This is very important. And the reason for that is that all of the process of digestion is managed by a lot of enzymes. And enzymes are an interesting group of factors. What they basically do is, if enzyme A does its job, only then enzyme B can do its job. Only then enzyme C can do its job. So these happen step by step, and they're dependent on the previous step. The first set of enzymes that the food comes across in your body is in your salivary juices. So when you eat, you feel like the gush of juices in your mouth. And so in that, there are all of these enzymes. So when you break and tear your food apart with your teeth and you chew well, those enzymes start mixing in with the food and begin the process of digestion. If you don't chew well, this doesn't happen very efficiently. So then the next steps need to work harder to try and make things happen. So it's just nice to give your body a break and make sure you chew well. Once you're done with that, it moves into the stomach, like I said. And the most important thing that happens here is the mixing of the food with the stomach acid. This is one of the first steps for protein digestion in your body. So if you don't produce enough stomach acid, you will have problems with protein digestion. Also, when you think about the stomach, the most common thing I'm asked about is stomach acid, acidity, and reflux. So this is something I'd like to talk about a little bit more. So if you look at the image of the stomach here, you continue to think of it as a tube, right? As a part of the digestive system, it's a tube. It has an opening and an exit. Both of these locations are controlled by valves. There are two valves which help open and close the stomach as and when needed so that food can get into the stomach, mix with the stomach acid and move out of the stomach. That's basically what these valves do. And these valves know what to do because of the stomach acid that your body is producing. So there are two scenarios that can happen. In normal digestion, when there is enough stomach acid being produced in your body, then you have initially the top valve is open, food can come into your stomach, the bottom valve is closed, the food mixes in with your stomach acid, then it tells that valve to open up, and now food can move into your intestine for digestion. This is usually what happens in normal digestion. Once the food is in your stomach, mixes with the acid, tells the valve on the bottom to open up so food can move through. Now, in improper digestion, if you don't have enough stomach acid, what happens? Those valves don't know what to do. So where they stayed open on top and closed on the bottom so food could come into your stomach, now they don't know to do the opposite so that food can move out. The lower valve just stays closed. So your food sits there and it starts accumulating. And the little bit of stomach acid that is present can start splashing back up almost into your throat region through this open valve. So basically what I'm trying to tell you is that you can have acid reflux even if you produce less stomach acid. And this can seem counterintuitive, mostly because when you think about acidity, you think you have too much acid. But you can have similar symptoms if you have less stomach acid as well. So now how do you tell the difference between the two? How do you know, are you producing too much or too little? There are tests you can do, certainly, but there are also some symptoms you can look for. So these are the ones. If you feel this reflux only after you eat food, then that basically means that you're not producing enough stomach acid, and so you feel that splashback. If you feel like food just sits in your stomach after a meal, even if it's like 30, 40, 50 minutes after you've eaten, if you just feel like food is just sitting there and it's not going anywhere, then that means that lower valve hasn't opened for your food to go through. And that's why you're getting this indigestion. If you think that eating more food can help relieve this, basically that lower valve will open for two reasons. When the stomach acid is mixed in with your food and indicates it should open. Second one is pressure. So if you have food sitting in your stomach, a lot of my patients tell me I feel gross for about half an hour, 40 minutes. And then if I eat some more, I feel better. You're essentially pushing that valve open because of the extra food you've eaten. Just the pressure can do it. And so these are just some symptoms to keep in mind, which will hopefully help you understand which way your body is going, because how that is treated is different. What is the first thing we do when we think of acidity? We try to take an antacid, we take proton pump inhibitors. Now, like an omeprazole. Now, of course, it'll help you relieve the symptoms, which are very uncomfortable and painful. But in the long run, if you're not producing enough stomach acid to begin with, you have the reflux and you take an antacid or a proton pump inhibitor, in the long run, you might be causing more problems for yourself because you're suppressing something that is low already. So that's why it is important to understand which way you're going and what you can do about it. There are a few things. The timing, the type of food, the amount of food will certainly matter. And this depends on the individual. Some people feel if they eat acidic foods, they get it more. Some people don't have that problem. So it really depends on the individual, but very often timing, type, and amount of food can make a difference to this acid reflux because of low stomach acid. And there are also some supplements that can help adjust your stomach acid production so that your body gets the message to do it at the right time and open that valve. So your food can move into your intestine. So that's about the stomach. The most important thing is the stomach acid production as well as mixing in with the food so the digestive process can continue. Once it moves from here, it goes towards the small intestine. And as the small intestine begins, there's a spot where all of these organs sort of dump their juices in, the pancreas, the liver, the gallbladder. These are full of enzymes. They're full of very important molecules and factors, and they all play equally important roles. If something is going wrong with your pancreas or with your liver, usually it gets to the point where this needs to be medically checked very quickly. It adds up fast. So that's something that I think people get involved in fast enough. The one that sort of lags behind a little bit is the little green guy, your gallbladder. So that's the one that I'd like to talk about today. If you have questions about the others, I can certainly answer them, but I'm going to focus on the gallbladder here. And the reason I'm doing that is because gallbladder removal surgeries have increased in number. In many cases, they are an emergency intervention, so it's very understandable that it's required. But the issue I have is that usually post-operation, the patients are told that, well, the gallbladder really doesn't do much, you're okay, just sort of eat light for a little while and then you should be fine. There isn't enough support that is given. And that is something that I have an issue with. And I wish people did pay more attention to this. Is the gallbladder important? Of course it is. It does a lot of important things. What are they? It stores and releases bile. Now, bile is a juice or something that's made in the liver, and then it's put into the gallbladder for storage, right? It's made in the liver, stored in the gallbladder. The gallbladder then concentrates that bile 50 times. Now think about simple soap versus a concentrated dish detergent. The amount of simple soap you need versus a concentrated detergent is very different. And each one has its own role to play. So this concentration is very important because it has all the factors really concentrated in it. And the gallbladder also makes sure that it releases this bile only when the food reaches your small intestine, because bile is irritating to your digestive lining. So if it just keeps dripping there, or if it's released at the wrong time, it can cause irritation of that lining. So that timing is also very important. So these are the three main things that it does. Stores the gallbladder, concentrates it, and then releases it at the right time. And bile is important for a few different things. It is a vital step in fat digestion. So if your gallbladder isn't functioning properly, you're not digesting your fats well at all. And components will help activate the thyroid hormone. So here is one way that your digestive system is affecting your overall health. If your thyroid hormone, if you have problems with your thyroid hormone, you have many different things that can go wrong. So this is why bile is very important. And the gallbladder is important because it makes sure you're getting this bile at the right time. So if you have no gallbladder, you're unable to do all of these functions very well. So what can you do? You will need some type of bile support for the rest of your life. And I can certainly discuss this in more detail if it's required, but there are supplements that you can take which end up being bile support that you have to take for the rest of your life, since you don't have the organ that helps do this for you. Now, what if you haven't taken your gallbladder out, but it isn't functioning very well? What do you do then? How do you know? One of the symptoms is that your stools will be of a lighter color, because your stools get the color from the components of bile. And if your gallbladder is not storing it, concentrating it, mixing it in with your food when it's required, then that color doesn't come through. So you'll have lighter stools. If you have any type of uneasiness or discomfort when you eat fatty foods, this can be fried foods, but it can also be healthy fatty foods like avocados, nuts, cheeses. So if you have any type of uneasiness you feel on a regular basis after you've eaten these foods, then that just means something's going on. Your gallbladder is not functioning as well as it could be. You have some type of dry skin because fat is not being digested and it's not being absorbed by your body easily, and your skin cells really require good fat storage. Pain near your shoulder blade. So you can get it in between your two shoulder blades or even more towards the right. And this is a very characteristic symptom for gallbladder problems. So that definitely needs to be checked. It also affects transit time, how long the food takes to pass through your system. So some people might have diarrhea, some people might have constipation, some might have a alternating of this. So basically you're not having regular bowel movements. So if you do have these symptoms, what can you do to help yourself? Again, that bile support becomes important, maybe not in the same dosage or with the same intensity as you would need it if you didn't have a gallbladder, but you do need something. And beets are excellent for gallbladder health. So, using it, if you do juices, you can have beets in your juices. Beetroot ukkari, fantastic for you. You can do smoothies, you can put it in your smoothies. You get beet powder, which helps really concentrate the amount you're getting of beets without needing to eat like pounds and pounds of beets. So you get beet powder as supplements in capsules, you can get them as tablets, you can get it as just regular powder, you can add to things. So these are ways you can add more beets into your life, and that can really help your gallbladder function better. And then once we're done with that, since I've talked about the gallbladder now, I'll move on to the intestines. That's how the food is now passing through. With all of these juices mixing in, the enzymes are doing their job. And so now we go into the next phase, which is your small intestine. This is important because it is the site of complete breakdown of nutrients. So once your food is mixed in with all of this as it's passing through the top part of your digestive system, within the small intestine, everything starts breaking down to its smallest components. Here is also where all the absorption of your vitamins, your minerals, your nutrients, so it not only breaks it down, it helps absorb everything into your body as well. So your small intestine is very important, and you need to make sure the cells are healthy so that they can break things down and absorb it from the small intestine also. Now, the next thing that's important, and there's a lot of words here, I'll explain it, it's about the serotonin receptors. Serotonin is a neurotransmitter, which means it's a messenger from your nervous system. And these messengers require receptors to connect to have the right type of signaling to happen in your body. 90% of those receptors for this neurotransmitter that helps you regulate mood, sleep, focus, and a lot of other things are found in your intestine. Just think about that. 90% of this neurotransmitter receptor, which is important for so many things in your mental health, is found in your digestive system. Here's a great way of showing how your digestive system can affect your mental health, right? Also, the reverse is true. People who have mental health concerns, one of the most commonly prescribed medications for people who have anxiety or depression affects the amount of serotonin in our body. It changes the level. So now if you're taking a medication like that, and 90% of the receptors for that neurotransmitters are in your gut, then one of the most common side effects of this most common medication prescribed is digestive issues. So if you take it for anxiety and depression, you might have a whole host of digestive issues that start. And this is the reason for that. The second very important thing about the small intestine is the immune system. 70% of your immune system is associated with your digestive system, especially around your small intestine. That is a huge amount if you think about it, 70% of your immune system. So now think, for people who have IBS, Crohn's, or any other type of issues and inflammation with their gut, if that much of your immune system is present here, that reaction will get magnified very easily. You also think about people who have inflammation outside of their gut, if they have like cancer or diabetes, cardiovascular problems, where you have higher inflammation in your body. If 70% of your immune system is associated with your gut, those will affect your gut as well. So this is again another sort of correlation between your digestive system and the rest of your health. A lot of times when when conditions are diagnosed or treated, it almost seems like people look at it as everything exists separately in our body. And that is very rarely the case. Everything is interconnected. So there will be downstream effects, and you have to sort of take that into consideration as well when you're looking at treatment options. So moving from the small intestine into the large intestine, this is the official residence of bacteria in our gut. This is where all the bacteria in our digestive system live, and nearly 5 pounds. If you think about how microscopic they are, 5 pounds is a lot of bacteria. If you have bacteria in your gut outside of the large intestine, it creates a whole host of other issues and causes a lot of problems. So this is where they need to be. Even if you have good guys outside of your large intestine, that can be a problem. Within the bacteria, you have two types. You can have the happy campers, which are the good guys. And what they do is, as your food is passing through, using different parts of your food, they start producing vitamins and other compounds that your body needs, and it gets absorbed here. So they do things that are good for you. It's a symbiotic relationship. They're getting something from it, and you're getting something from it. And then, of course, you also have the bad bacteria. And these guys, what they do is, as the food is coming through, instead of producing things that are good for you, they start fermenting things. So if you feel gassy or bloated after you eat, maybe like an hour or so after you eat, it could indicate that you have bad bacteria in your gut, because they're fermenting the food and causing gas rather than producing the vitamins and other compounds that your body needs. Also, if you have a higher amount of bad bacteria in your gut, it can increase toxin load because it constipates you. It can constipate you. And so all of that waste is laying around in your body for much longer than it needs to, and it increases toxin load. Large intestine is also important for the reabsorption of water. It's the final place where that happens. And so if you have issues with your large intestine, you can have diarrhea because that water hasn't been absorbed. And of course, forming and excretion of waste. So just as a recap of my anatomy class, which hopefully wasn't too boring, your digestive health is linked to your mental and physical health. This is very important to understand. Digestion is a process which occurs in a tube in our body. You have to chew your food well. That's very important to start the enzymatic process. Pay attention to the reflux that you have so you can see whether it's because you're producing too much stomach acid or too little stomach acid. We talked about your gallbladder health and how important that is for fat digestion, as well as your thyroid health. And small intestine is important for breakdown and absorption of nutrients, but it also plays a big role with your mental health as well as overall health because of its connections with serotonin as well as the immune system. The large intestine is home to all of the bacteria in your gut, the good and the bad, and it helps form and excrete waste. So this is like a quick recap of everything that we just talked about. Now, as I was going through the process, I did talk about some quick tips on what to do with various symptoms that you might have. But if you need an overall sort of just need to get your digestive system to calm down, is there anything you can do? Just the role of nutrition and lifestyle changes. What role can these play in your health of your digestive system? So that's what I'd like to talk about next. This is called the 5-hour program. It is a series of clinical steps you can use to help yourself. There are 5 basic steps to this: remove, replace, re-inoculate, repair, and rebalance. So these are the 5 steps. Step 1 is remove. What do you remove? You remove all the things that are bothering your system. This can be pathogenic organisms. It can be a parasite you have, maybe some type of infection that needs to be addressed. Any toxins in your immediate environment within your house. What are you heating your food in? What are your detergents? What do they look like? Those types of things. Just looking at whatever is in your immediate surroundings and what can you do about that. And then allergens from your diet. So if you've developed sensitivities or allergies as you've become an adult and past that, you need to remove those. How do you know if you have allergies or sensitivities? You can do a food antibody test and determine this. It's a blood test that you can get done. Or if you aren't able to get that done, you can just start out by removing the most common allergens from your diet. Dairy, peanuts, corn, wheat, soy, eggs, shellfish. These are the things that a lot of people can be allergic to or sensitive to. So you start out taking these out from your diet for a few weeks, then you add it back in and you see how your body is doing as you add each one back in selectively. So that is another way to do it. That has more trial and error because you don't have definite answers as you would from a blood test. But then it depends on access as well.
Get my medicines from upstairs.
This is a critical and essential step to do because you have to remove these irritants. Otherwise, you get into a cycle of you're trying to calm your system down while you're continuously irritating it. So making sure you remove these irritants becomes very important. Step 2 is replace. What do you replace? You replace any factors, digestive factors that might be deficient. So if you have low stomach acid, what can you do about that? If you aren't producing enough digestive enzymes, what can you do about it? How can you support your bile production and release? So thinking about all of these and looking at the supplements or the type of food, the timing of food, amount of food, looking at all of this can help you determine this. This is important because you spend all of this money on making sure you're getting the best food that you can. If you aren't able to digest and absorb it, you're really essentially flushing money down the toilet, right? At that point, because you're just not getting anything out of it as well, as much as you could. So that is just something that you have to keep in mind and make sure you have all of these things taken into consideration. Then step 3 is to re-inoculate. And what does that mean? That means you reintroduce the good bacteria into your system. And you do this through probiotics, especially if you need it for a therapeutic purpose. I'll talk about fermented foods in just a second, but probiotics are something that we use for people who have digestive concerns, but specific digestive concerns. Now, research has shown that probiotic benefits are strain specific. What do I mean by that? If you look at the image that has popped up on the bottom of the screen there, just like we have a first name, a middle name, and a last name that helps identify us, bacteria have a genus name, a species name, and a strain number that helps identify them. So any research that is done, research has to be very specific, right? Because it has to be repetitive and people have to be able to replicate it as well. So you can't have very vague terms when you're doing research. It has to be very specific. So what they do is they look at a particular strain of bacteria and then they tell you, this one is good for people who have Crohn's. This one is good for people who are going through chemotherapy. This is good for somebody who just needs some general wellness. This is good for somebody who might be overly bloated or having some type of a parasitic infection. So all of these are done by the strain. And if you look at a lot of the probiotics that you can buy in stores, when you turn it around, you might not see the strain number there. You might see just the genus and species. Lactobacillus, a lot of us have heard of that name. You might see Lactobacillus acidophilus. But Lactobacillus acidophilus NCFM is the one that has shown to be good for general wellness. The Plantarum 299B is something that can help people with IBS. So these are all strain-specific benefits. So you can't just buy a random probiotic and hope that it will help you. So that is just, this is something that people talk to me a lot about because I think probiotics have just become one of the most common supplements that people tend to take. So I like to talk about that a little bit more. Make sure you get the genus, species, and strain. So are fermented foods good sources of good bacteria? Of course, they can be, but if you have a specific concern that needs to be addressed, you need a specific probiotic, and the best way to do that is through a supplement. So this is one of the few things where I insist that if you need it, it's best to get it through a supplement. You won't, because in the foods, when you ferment it at home or they fermented it in a store, a factory, wherever, you won't find those specific strains. It'll be more generalized, right? So if you have particular issues, you need the right strains. And also the dosage matters. Foods will have maybe a few million colony forming units. CFU is how you count bacteria. So just your fermented foods will have a few million colony forming units, maybe a little more in the tens of millions or hundreds of millions if you think about when they're produced, mass produced. Therapeutic dosage that I use in my clinic can go from 6 billion to 60 billion. So it's a huge difference between the amount. So yes, fermented foods are great for you to have in your diet on a regular basis because they have many benefits. But if you have something particular that needs to be addressed, you need a probiotic that will do it for you. Step 4 is repair. What are you repairing? You're trying to repair the intestinal wall. where I talk to you about how, because the small intestine is the site of breakdown and absorption of nutrients, and you have your immune system and you have those receptors there, you need to make sure those cells are healthy. One thing about my talks is that over the years, I've realized, I've been doing this for over a decade, and I've realized that if I give a list of nutrients, vitamins, minerals, and I give dosages, people tend to take all of them. And that's never the point of the conversation. So what I do instead is I give you food sources. And if you're somebody who needs the supplements for it, it is best to talk to a healthcare professional who can make sure you're taking the right ones, the right dosages, because all of that is very dependent on the individual. So the nutrients that can help repair that intestinal wall is an amino acid called glutamine, which is very high in homemade broths and soups. And this is true even in our dals, like because of the lentils in there. Any beans, legumes, lentils you can use if you're vegetarian, with a whole host of different vegetables. And if you can make a broth for yourself, that is excellent in helping repair that intestinal wall. If you eat meat, including the bones of the meat in there, will help increase the amount of glutamine because that's concentrated in the marrow. Vitamins like vitamin A, C, and E, and these are found in citrus fruits, bell peppers, carrots, nuts, and seeds. Now, vitamin C, most people think about citrus fruits as the highest source of vitamin C. Red and yellow bell peppers have more vitamin C than citrus fruits. So it's really nice if it's something you want to include in your diet, raw or cooked, whatever works for you. Minerals like zinc and manganese will be found in green leafy vegetables. An antioxidant called glutathione will be found in cumin, asparagus, potatoes, garlic, tomatoes, avocados. So one thing to keep in mind here is just looking at it and seeing that including multiple fruits, vegetables, and colors, having a variety is very important. We tend to eat the same things again and again. Stepping out of our comfort zone will really help our overall health. And then the last one is rebalance. What are you trying to rebalance? You want to improve your diet. And I like to say, eat food as close to its real state as possible. Eat real food as close to its whole state as possible and simply cooked. You don't need restaurant style meals to get your nutrients. It can just be a simple curry that you make at home, and it's giving you just as many nutrients and being just as delicious. Eating multiple well-balanced meals through the day. It's best to make sure you aren't going hungry for long periods of time between your meals. So you can do a breakfast, a small snack, lunch, a small snack, and dinner, or even just 4 meals is also fine. But make sure you don't have too many hours between your meals. Work on stress management, and I cannot talk about this enough. I do a whole other presentation on this, is never underestimate the effects that stress can have on your life and on your body. Just this past year has shown us at the rate at which stress levels skyrocketed in the world, and now just the very random and vague symptoms people are coming in to see us about. It's really interesting to see how that happens from like a science perspective. As a person going through it, I understand it's not simple, but working on stress management is very important. Deep breathing exercises, some people do meditation, anything that can help you focus on something else and help clear your mind for a little while will play a big role in making sure you sort of rebalance your life. And then, of course, you look at your exercise routine. If you don't have one, what can you introduce into your life? And this completely depends on the individual, their personal health, their fitness level, and everything else. So you need somebody who can help you find an individualized way to do this. And if you have an exercise routine, can you improve it? The idea isn't to exercise till you pass out. You exercise smart, not hard. So what can you do to help yourself there? So as a recap, we have the 5-hour program that can help you really sort of reset your digestive system and help your overall health. You remove any of the irritants, you replace any digestive factors, you re-inoculate with good bacteria through specific probiotics if required. Repair your gut lining by making sure you eat a variety of food and introducing broths and soups into your diet. I usually recommend that my clients have like a cup or so of some type of broth or soup maybe at least 3 times a week if they have a very irritated and inflamed digestive system. Rebalance your diet, your lifestyle, and exercise routine. So these are just some of the things that you can certainly do to help yourself. And now that I've spoken for this long, I'll be happy to take any questions that you might have. Like I said, I have my website and my email here. If you want to get in touch with me, please don't hesitate. I'll be happy to help you as much as I can. So thank you for your time today.
Thank you, Akshita, for that excellent presentation. I know it has been, you have made it so simple and easy to understand. Some of us knew that we had some issues with our digestive systems, but you have made it very simple. Thank you very much. And also thank you for offering to get the calls or emails so that you can answer questions
Yeah.
on an individual basis.
Yeah.
So actually, as I said, there are quite a few very interesting questions.
Mm-hmm.
And those who have additional questions, please put it on chat. Surekha is monitoring them. First of all, I just want to mention to the listeners that these questions are from the audience, none of to do with me. So please don't think that all the issues are only for me. So just want to let you know. Okay. Uh, okay, let me try the first question. For efficient digestive system, what is the role of timing of food intake and the amount of water you drink and when you drink it? Can you just give us some explanation whether how much water you have to drink and when you have to drink, and same way about other food, etc.?
Yeah. So in terms of the amount of food, it's just good to, there tend to be two different types of people. Either people who eat like 3 big meals and don't eat anything in between, but have a lot of time in between those meals. Or there are people who are grazers who just keep like hangyatana, vatana, something, put something in your mouth type of a situation. So there tend to be two different groups of people. But what is important to keep in mind is, like what I said, eating well balanced, smaller meals through the day rather than trying to hit 3 big meals in a day. So you eat if you're somebody who counts calories, you're eating the same amount of calories, just the way they're distributed is different. So that's one thing. You want to try and keep about maybe a couple of hours, 2.5 hours, maximum 3 hours between your meals during the day. So you don't want to go too long without eating. So that's in terms of timing of food. Timing of water, that is interesting to me because people tend to react differently to this. I've had people who will drink copious amounts of water with their meals and they have no problem. And others who, even if they take a few sips, will have a problem. For me, a little while ago, in fact, last month and month before that, actually from last year, this is something that I was suffering from, was the whole thing where I talked to you, where if the bacteria get outside of your gut and into the rest of your system, it can cause problems. That's something I had, including a parasitic infection that I was dealing with. And even if I had a little bit of water any time of the day, if it was, especially after a meal, I would feel like I wanted to throw up. So it really depends on the individual in terms of water and timing and amount and what else is going on with you. So I know a lot of people say don't drink water because it'll dilute your stomach acid or things like that. Your body isn't that fragile. It really isn't that just a little bit of water will mess up something that should be so well controlled. But if you are somebody who's already having digestive issues, you might notice that drinking water while you're eating makes you almost feel like food is just floating around inside you. It just makes you feel like the indigestion even more so. So that can certainly happen, but it's very individual. So for me to make a blanket statement will be difficult. All I can say is make sure you're drinking plenty water through the day whenever it is comfortable for you. There isn't like a particular time of the day when water is best taken in or anything like that.
So in the same line, is breakfast necessary for a good digestive system, or just 2 meals a day enough?
Yeah, so I think this is coming from this whole idea of intermittent fasting, this idea of, skipping your breakfast or having a long period of time between when you had dinner and when you have your first meal of the day. This is definitely a question that's become more common. Um, Breakfast is important. Well, let me back up. With intermittent fasting, it might work for people. Clearly, there are many people who have written about it and benefited from it personally, and there are many others who've benefited also from it. But again, nutrition and diets are not something that you can easily make blanket statements about. And I think that's why this field has and topic has become as confusing as it has, because where everyone needs to be doing what works for them, there are books and websites and shows and everything sort of put out there for with blanket statements. Just because it works for you, it might not work for the other person. That's something to keep in mind. Intermittent fasting, I've had people who've told me that it's helped improve their focus and mental acuity, especially in the morning, where they used to always feel sort of like their brain had molasses in it, is how someone described it to me once, just very slow. So I've had that described to me, but I also know people who have blood sugar monitoring issues, diabetes, pre-diabetes, or anything, or hormonal issues. If they try intermittent fasting, it can backfire on them. I know that. So it's very important to make sure you're doing it properly. In terms of breakfast by itself, is it important? I think it is, yes, for most people. When you wake up in the morning, I like to tell people at least within an hour or two of waking up, it's a good idea to eat something. And again, this is, based on an individual basis. But what the breakfast helps you do is not only this idea that it prepares you for the rest of the day, but it helps you recover from the night before. When you're sleeping is when your body does most of its healing and repair work. So you wake up with your body almost starving. So it's a good idea to give it something at that point so it can sort of calm down, get its nutrients again, and get going again for the rest of the day. So for that reason, I think breakfast is important. It's not something I skip, but I also have make sure that it's not like a giant meal, something that will bog me down for any reason. So yeah, it's again depends on the person, but I think breakfast is important.
Uh, just another side question. Is it important that you have to eat the food at the same time each day?
Not necessarily. I mean, if it's a little up and down, there really isn't anything wrong with that. As long as you're making sure you're not going like 4, 5, 6 hours between your meals, you should be okay. Even if it's something small, like a few nuts, 4 or 5 almonds or whatever, that's enough. It's just giving your body a little bit of a boost when it needs it. Um, a lot of times, I don't know if this is something that had ever come up. Here, there were ads about the 2:30 feeling, where you feel tired and ready to crash in the afternoon, and you drink this 5-hour energy drink, and suddenly you can get through the rest of the day. Well, if you eat anything at that point, you'll be able to get through the rest of the day. So it really depends on what your routine looks like, and how many, if you look at your daily routine, how many calories you should be eating and what time you're eating those. So as long as you're not putting a huge amount of time in between your meals or between a meal and a snack, you should be.
Okay, sometime back, a lot was written about this the next question. Uh, is it good to eat fruits before, during, or after meals, or doesn't it matter when you eat them? How does each of these affect the digestive system, like the duration or when you eat?
Yeah, there was definitely a lot brought up about this. Again, I mean, I feel bad repeating the same thing again and again and again, but if you're somebody who's diabetic, I would be careful more about how the timing of your fruits, what you're eating it with. Those things will matter more when you have blood sugar handling issues. If you don't, you really don't have to worry as much about it. I think what happens with nutrition diets, especially, is that every few months somebody comes up with a new thing to publish about, or say something controversial about, and then everyone gets confused about it because it goes against common sense. And that's true, it does go against common sense. But this is also the reason why there's that much confusion. The other thing that happens is that, like I mentioned about the probiotics, research is very specific. I worked in research for 7 years. Um, and research is extremely specific. They can't do research on an apple. They have to do research on a specific component of the apple. And unfortunately, when this research is presented to the general public, those nuances are lost. Instead of talking, about the details, you get headlines like "dark chocolate is good for you." No, not really. The research that was done was by a company, funded by a company that created a specific dark chocolate bar that allowed them to get the results that they needed. And then it just got translated into "dark chocolate is good for you. Please go ahead." Same thing with red wine. There are components of red wine that have been, studied, and all of a sudden now red wine is good for you if you have cardiovascular issues. Well, if you wanted to get the components at the same amount, you would need bottles of red wine, which, yes, some people, that would work well for them, but it could cause a whole host of other issues. So there is always this sort of disconnect between research and how it's presented. There is always a disconnect between people who are trying to publish new material. They obviously have to say something either controversial or something that's very new that sort of disrupts the space so that they can get the publicity or whatever else that they need. So unfortunately, nutrition is one of those fields where this happens very often, and everything starts getting confusing.
Yeah, I've heard about that red wine, and I
Yes.
try to follow those instructions as much as possible.
Yeah, I'm sure.
Thank you. Uh, just a question, you did mention about probiotics. What is
Mhm,
your take on taking the probiotic pills
mhm.
instead of eating all those foods that you have mentioned?
Yeah, taking probiotics is, if you have a particular concern that needs to be addressed, taking probiotics makes sense. If you don't, well, even if you have a particular problem, normally you take a probiotic supplement only for maybe a month or 2 months. It's not something you take from here on. Because the idea is that once you re-inoculate the bacteria, if you eat the right foods, the good bacteria will stay and they will thrive. So if, I've had patients who are undergoing intense medical treatment, then they need to take it for a longer period of time because that treatment might be affecting the efficacy of the supplement. But if you don't have something that's ongoing, then taking it for a month or two is enough. The idea is that you change your diet during that time. So you start supporting the good guys in your body. So that's the basic idea behind probiotics. So taking it is not a problem at all. Which ones do you take? For how long do you take? And how much do you take? Those are the questions that should be asked instead. And the best way to find out is to speak to somebody who can look at your case and decide what's required for you.
Thank you. The next question has a little bit of a long question because he has given us a little bit of history. So just I'll try to read it very slowly. I am a senior citizen with type 2 diabetes for 20 years, calcium oxalate kidney stones for 10 years, and hypothyroidism for 2+ years. Mid 2020 started experiencing abnormal belching and constipation.
Mm-hmm.
Initial attempts at reducing or eliminating specific foods were not effective.
Mm-hmm.
Gastroscopy in 2020 was normal. Over the counter medications not helped. I am currently in week 7 of FODMAP elimination diet,
Mm-hmm.
which has also not helped.
Mm-hmm.
This week, the dietitian has ruled out irritable bowel syndrome.
Mm-hmm.
My doctor said I should try to eliminate more foods to determine the cause of belching.
Mm-hmm.
What suggestions do you have for taking care of my digestive system?
Wow, that's a rough time. I'm sorry for whoever that is. So one thing would be a difference between, the trial and error of eliminating foods and seeing what works. That can certainly be something that someone can help you with. Like, you need specific help to look at your diet and see what food you're eating often when you're getting the symptoms. Like, that will take a lot of effort on that person's part, as well as the person he's working with, to figure this out, because you need to find patterns. Essentially, I get some of my clients to do like a 1 week symptom list as well as food list. what they're eating, when they're eating, how much they're eating, and then how they feel during the day, including mental symptoms as well as physical. And so that takes a lot of work to sort of look at it and try and find patterns and see what foods might be bothering them. The other one would be to see if there's any type of a food allergy or sensitivity test or profile that the doctors can get done for them. There are blood tests that can be done. The skin prick tests sometimes aren't as effective, especially if the person has a lot of things going on, because your body is so inflamed, you can have cross reactivity at that point. But that's also something, a spot to start is just to try and do some tests instead of a trial and error if possible, to see if these foods can be sort of, you can figure it out easier, and take those out. So certainly food can have an issue with, belching and constipation and things like that. But it sounds like this person also has a lot of some comorbidities that have existed for a long time. When you have chronic conditions like that, the way it affects your entire system, like it changes a lot of things. So somebody has to, usually it's one doctor endocrinologist looking at the diabetes stuff, somebody who's looking at, you've had kidney stones, somebody else who's looking at, the digestive issues. If there's somebody who can look at everything and pull back and see if there is some way that these things are connected and what can be done for that person, that I think would be useful. I also think doing simpler foods, doing the broths, all of those would be helpful as well.
Thank you. Thank you, Akshit. The next question is definitely not from me. Uh, I am 31-year-old. Just let me repeat it. I am 31-year-old female with a 3-year-old girl or a daughter.
Mm-hmm.
I've recently come to know that I have gallstones.
Mm-hmm.
So in order to avoid pain attacks, I've stopped lots of things like oil, butter, ghee, maida, etc.
Yeah.
Even though I'm having more of vegetables and juices, I feel low on energy
Yeah.
and started losing lots of hair.
Yeah.
Could you please suggest some diet tips and tricks which will be easy to digest and give me energy as well?
Yeah, absolutely. So when you have gallbladder stones, that's one of the most common things that can happen with your gallbladder is you have gallbladder stones. What it does is it blocks the duct and your bile can't be sent out as it's required. So it just sits there getting more and more concentrated, and it becomes sludgy. So this can also affect your mental health quite a bit. In fact, the word melancholy comes from black bile, which is essentially bile that's just been sitting around and getting sludgier and darker and darker and darker. So what can be done about it? You have your choices are talking to your doctor and seeing what needs to be done about the stones, how bad they are. In the reason why gallbladder surgeries have gone up is because of gallstones and it being used as a treatment for gallstones, gallbladder surgery. So reducing the amount of fats in your diet will help to an extent, but that then brings into all of the issues that she's been having, which is the low energy, fatigue, loss of hair. You're missing nutrients at that point, essentially, is what's happening. You're not able to digest and absorb these nutrients that you need, and so that causes the problems. Taking supplements won't really help as much because those supplements also need to be digested and absorbed, and you aren't doing your digestion and absorption very well. So I would suggest talking to the doctor about what would be a good way to try and get rid of those gallstones. There are people who talk about detoxes and gallbladder flushes. That is a difficult thing, and not something I recommend, because if you have small stones, they might flush out. But if you have one large stone and it gets stuck, you are in a lot of trouble at that point, and that's not good at all. So I wouldn't recommend the flushes, but talking to the doctor about what other options are available. If not, you can try the bile support while you take these fatty foods, add them back in slowly, a little at a time. And by bile support, it sounds gross, but you essentially have bile from another animal. They do ox bile. And so you can take that and see if that helps you digest, fats and other foods that you've been avoiding. And see if that will help you so that you're getting the calories you need, you're getting the nutrients that you need. What happens to a lot of people that restrict food, one, you become scared of food. That is never a good relationship to have with food. And second is that intentionally or not, you restrict your calories very severely without even thinking about it, trying to do it. And so both of those can have lasting impacts on your mental health. So I think it's important to either talk to the doctor about options on how to treat the gallstones, if there are any, depending on, like, I don't know what her scans look like or any other test results, looking at that. Or the other thing I would recommend is taking some type of bile support and including all the beets in your diet, like I'd recommended, and seeing if that can help the gallbladder come back, sort of start functioning better, maybe release some of the stones, do something like that. Yeah.
Okay, the next question I
Having a
also,
3-year-old with gallstones, oh my God, I have a 3-year-old without gallstones. And I'm always tired, so I can't imagine.
the next question I also wonder quite often. People say that this food is good for liver, that food is good for eye, etc. How does specific food know where to go and how it reaches?
That's a good question. How does food know where to go and have its effect? It doesn't really. It's mostly what the foods are rich in, right? So there are certain foods that are rich in certain nutrients, and there are certain organs in our body that need those nutrients. Like I talked about the glutamine. Glutamine in broths will help your body in many different ways. It's a very important amino acid, but it'll help your intestinal cells the most because that is their primary source of fuel. So it's not that the food has to go to a particular place and only then have its effect. The idea is that your body digests it, and then as it absorbs it, whatever part of your body needs it, it'll find its way there. That's just biochemistry. I would have to go into quite a bit of detail on how the different cycles and things work, but just be confident in knowing that your body knows how to do its job.
So what's good for one part is not good for the other part, doesn't happen, right?
It's not like that at all. Everything is good for all parts, but if there's one that requires more of it, it'll get it.
Okay. This is a general question.
Yeah.
What does an applied clinical nutritionist do? How does a nutritionist differ from applied clinical nutritionist or dietitian?
Yeah, I think it's mostly just how the programs have been developed. Dietitians and registered dietitians have more, they do a lot with the macronutrients. And if you go to a registered dietitian who's working with a doctor, for example, who is working in a hospital, they'll talk to you a lot about, like, what type of carbs to eat, how much protein. And so it's a lot of macronutrient type of breakdown of food that they'll give you. And they'll, pay more attention to, like, the FODMAP thing that someone had spoken about and things like that. An applied clinical nutritionist like me tends to be able to pull back a little bit more and look at overall health and how your digestive system can relate to that. This is by no means in any way trying to say that my degree is better than somebody else's degree. It was something that worked for me because at that point of time in my life, it was available. And the person who helped treat all of my health concerns created the program. And I just wanted to know, having already had the biochem and science background, I'd already had my Master of Science in biochemistry by then. I was just stunned that the science could be applied in a different way. And so that's what got me interested in it. So in terms of what is done, I think the type of suggestions that are expected from the people might be a little bit different. Also in hospitals and in doctors' offices, dietitians tend to be more constrained because of insurance requirements. At least in America, the whole thing of insurance and how that constrains things. So that can happen. I don't do insurance for my practice for that reason. And it allows me to do an hour to an hour and a half long appointments, which I think help me cover way more information and look at test results from other practitioners, coordinate with other practitioners to see how I can help the best overall, not just for a specific thing.
Back home, they used to take some of the things on a regular basis. For example, castor oil or herbal concoctions on a
Yeah,
daily basis, even
yeah,
for a digestive system.
yeah.
Uh, is it really good for system? And the second thing is, what can we do here? In
So there'll always be, mom's remedies and granny's remedies. It'll always be there in every culture, no matter which one you go to. There will always be home remedies that used to be done, or still are in many cases. I haven't studied herbs enough and that's why I don't use them in my clinic. I don't know enough about them in enough detail to be able to work with them to the extent of, with people who are already on multiple medications, your herbs and things can definitely have interaction. So it's just one of the reasons I don't do herbals in my practice. Doing it at home, like I remember when I was pregnant and I felt like I was bloated, everyone would tell me, put jeera kashai, have this kashai, have that kashai, do this, do that, put, ghee here, put that there. And so there are always lists and lists of things that can be recommended. You can certainly try it. There's, given the amount or when it's a whole food, the concentration of the particular component that might be doing its job, it's not that much. So, if the jeera kashai helps you feel better, please drink it. I'm not going to say don't, there's nothing wrong with it. But you have to make sure there are certain things you have to be careful about. For example, if you have cardiovascular issues and you're on any type of blood thinner, you have to be careful about the amount of fish oil supplement you might be on. You have to be careful about the amount of garlic if you're on a supplement, how much garlic you're taking, because all of these can be blood thinners. They can have blood thinning effect. And so it can exacerbate that whole problem. And you don't want that to happen. So as long as nothing like that is happening, you can speak to, a dietitian, nutritionist, your doctor, and just see, as long as there's no interaction or any interference like that, there really isn't anything stopping you from doing these home remedies. What I do suggest is that if you have a particular problem, make sure you speak to a healthcare professional first before you try a whole list of homemade, home remedies. And then by the time you get to the doctor, it's been much longer and the, issue might have increased. So it's best to always make sure you have a professional you can talk to. And as long as they don't consider that, it's an issue that can impact you in a negative way, if there are certain home remedies that help you, then certainly go ahead.
Thank you.
Yeah.
Some say, for example, that potato peels contain more vitamins. Is it safe to eat potato peels raw or cooked?
Cooked is fine. Raw, I don't think will taste good in any way. I don't know if this is my laziness or if it is, the nutritionist in me, but I don't peel potatoes, just it takes too long. But I make sure I wash them well before I use them, before I cut it up. So just use a brush and, make sure it's all washed well, scrubbed. And then, you don't have to peel potatoes. That's perfectly fine. It does. The colors that your foods have because of the skin indicate the type of nutrients that are in there. Red fruits have, high in certain nutrients. Blue foods are high in certain nutrients. It's just the colors indicate that. And so, yes, if you have the potato, the skin will certainly have nutrients that the rest of the body may not have as much of. So yeah, there's nothing wrong in eating the peel of a potato. Have it cooked, because I don't think raw will taste very good.
Thank you. This is the last question from the pre-submitted.
Yeah.
After that, Surekha will have lots of questions.
Okay.
This is also a very simple general question. Is it true that all vegetables are safe to eat raw? Any ill effect of eating raw vegetables?
You want to make sure, so, there's the whole raw movement that eats only raw foods, maybe desiccated or whatever, but they're mostly eating raw foods. Now, there are certain nutrients that you get from foods when they're cooked, and there are certain nutrients that you lose from foods when they're cooked. Both of those things can happen, and that's the reason having a mix of raw and cooked is better. So, if you want to snack on something, you can snack on like raw vegetables, that's perfectly fine. And in your meals, you can have the cooked versions of it. So it isn't one versus the other. It'll be a combination. And I think adding variety of colors and textures and all of that to food makes it more interesting. For a lot of us, and we tend to eat a restricted diet. We buy the same 5 vegetables from the grocery store. We cook it in a particular way, and so it always gets more interesting and exciting if you can introduce different textures, colors, and flavors. So I think that's important to encourage. For some of my clients, I encourage them to go to the grocery store and buy one vegetable they've never bought before. I mean, it could be as simple as scallions that they've just never tried before, or it could be rutabaga that they just don't know what to do with. And then I try and help to find them recipes that sort of fit in the flavor profiles that they like, and see if they can try it out and see how it works out. The other thing that I do often with my clients, and this works really well if you have kids who might be picky eaters, I give them a chart which basically has the days of the week. And then I tell them to color in the foods they've eaten throughout the week. And over, a week or two, I've had most of my clients that tell me, my daughter said she needed to use a blue crayon in her chart, so we had to go and buy blueberries, or something like that. So they get more interested in the foods. They feel more control over what they're eating, and it helps encourage them to eat all of these new things. So yes, a mix of raw vegetables and cooked vegetables is good. A mix of variety of colors, textures, all of that is important as well. So try and get out of your comfort food box.
Thanks, Akshita. Over to you, Sureka. You have to
on mute still. Yeah.
Got it.
Yeah.
Thank you, Sudanand and Akshata. I've applied all the illnesses from whatever conversation you've been saying. I'm like, I must be having that. Right?
Oh, great.
So
yes,
I
my
have a
intention
question
was
for,
to make your day more complicated.
I'm like, oh, I must be feeling that because I'm short on this food or that food or anything, right? That's a natural human tendency, I guess.
Yes, it is.
So the one question for you, there are a lot of questions. First of all, a lot of positive comments. They appreciated your simplistic way of approaching and us able to relate to
Oh, good.
things.
Thank you.
Yeah, so a lot of kudos to
Thank
you.
you. Mhm.
And people also want the recording, and you have agreed we'll make the presentation available to people
Yes.
afterwards. We'll do that. We'll host it on our OKA website as well. So that way it's easier for folks who haven't been on our distribution list. I know there are other folks outside of the Konkani community who have joined us, and I want to thank them for joining us, and I appreciate their support. We will make sure it's on our website, so that's the best way to reach and get the information in terms of the presentation. Before I go to all the questions, there are a lot of questions, mind you, and I appreciate you haven't had water at all. You've been talking nonstop. Is about thyroid pills,
Yeah.
and gallbladder. You spoke about that.
Yeah.
And I don't know, including myself, we all take thyroid pills. It seems to be the next best thing that everyone has in their lives. So is it an issue of gallbladder functioning then?
Not always. There is a very strong link between your liver, gallbladder health and your thyroid health because of that component in the bile that helps activate the hormone, like I mentioned. So there is a very strong relation. And I do see people who have gallbladder issues over a few years of time will develop thyroid issues more often than not because of this. If your hormone isn't getting activated as much as it should, you start experiencing a whole host of symptoms. Now, this is not the only reason that the thyroid can have problems. And if you've been on some type of a thyroid hormone replacement for more than 6 months, it's very difficult to go off it. So you have to sort of form your, routine around it. And again, this is, most people expect me to say that medical intervention or any of these things are a bad thing to do. And I don't think of it that way at all, because you wouldn't have gone in for that intervention if it wasn't interfering with your life enough, right? We don't randomly go and ask for pills from doctors for no reason. Most of us don't. And so I think that if you were in a situation where you've had to start your thyroid hormone replacement, what you can start doing is just making sure that you're timing your food properly, because that's important for your medication to work. And also making sure you have some type of an exercise routine that you've included in your day-to-day life. That becomes important too, because your thyroid is so important for your metabolism. Making sure you have the energy for that, the type of foods you eat, when you eat it, all of those things become important. So yeah, it's not just the gallbladder that can cause, or liver that can cause, downstream effects on the thyroid. The thyroid itself can have a lot of problems, including Hashimoto's, which is where your body starts attacking your thyroid. And so there are a lot of different things can happen. I also recommend making sure your salt is iodized. I know that there are like 5 million types of salts now available in all these different colors. But the main thing I would suggest is making sure that you have iodized salt, because that is important for thyroid health. Unless, of course, you've gone to the other side of, usually I see people who are hypothyroid. If you're hyperthyroid, the treatment is different. But I'm talking about hypothyroid, where it's not functioning as well as it could. And that's why you're on the hormone replacement. Yeah.
Thank you. I'm going to scroll down through the questions. So some of
Yeah.
them are, just congratulatory comments. So I'm going to take a little while, not too long. But while I'm doing that, can you tell me one thing? Is it a myth or not? I don't know. Some people, and that includes me, like a lot of ice in my water, versus people telling you don't drink such cold water. It's not good for you. Your body. There was one practitioner with Japanese education who said you could be freezing your organs internally with such cold water. You got to stop doing that. Can you comment on that when I start with the questions?
Yeah, absolutely. So yeah, it is always interesting to me to hear when there are comments or suggestions made like this, mostly because your body is very well regulated. You can't mess with it that easily. Even if you think about the concept of alkaline water, it's hitting your stomach, and the stomach acid, the alkalinity is going poof. There's like nothing really there at that point, right? And pH is one of the things that is very strongly regulated in your body. And temperature, if just drinking ice cold water could change your temperature, then I mean, how are people living in extremely cold weather, right? So it really isn't that easy to mess with your body, though for a lot of us it might feel really fragile, because we are in situations where even the smallest things we do tends to just make our body overreact. I understand that. I am one of those people. I'm the reason they put rare side effects may include on every supplement and every medication, because I'm the one who gets all of them. So I totally get it. But you have to understand that the human body is it's stunning in all the things that it can do and the things it can regulate on its own. You don't need to help it unless it's asking for it. So yeah, drinking cold water, the amount of water, the timing of water, how it'll, dilute your stomach acid, your body doesn't care about those things. It'll regulate itself the way it needs.
Thank you, Akshata, because, I stopped drinking cold water and I couldn't. And then I went back. I said, I don't care if it's freezing inside. I'm going to drink what I want to do, right?
Yeah, no, please drink. That's the other thing. What makes you happy? Keep an eye on that.
Okay, thank you.
Yeah.
So here's a question. It's quite a thought-provoking question.
Okay.
Does mental health affect digestion, or is it
Yes.
digestion that affects mental health?
So this is a good question, and it's actually a workshop I do separately, is the brain-gut connection. And this is something I'm very interested in, because I have anxiety and I have clinical depression. And so I know what happens. I know how illogical things can seem logical at that time. And then I also know when I'm having an episode of anxiety, what it does to my digestion. So this is something I've been interested in for a long time. I didn't know where to go, how to find the answers, because by then I'd left research, and even the topics that I was doing in research weren't directly connected to this, so I couldn't make an impact then. But over the last, I would say, at least a decade or even closer, there is a huge amount of research that has come out that shows this exact thing, that both are true. Your you have an entire nervous system associated with your gut that can function pretty much independently of the brain in your head. So that's one thing. But they're finding a lot of connection between your brain and your gut. A lot of the signals tend to go from your gut to your brain than from the brain to your gut. That's what they're finding. And so you can ask what came first, the chicken or the egg. But I think it's just a very strong connection between the two. And you can't always say that it'll happen only in one way and not the other. It depends on what's going on. Just the one simple example I gave of the serotonin receptors in your gut. The most common medication that is prescribed for anxiety, for depression, is a selective serotonin reuptake inhibitor. It's called SSRI. That changes the amount of serotonin that hangs out in your brain, and that helps calm you down if you have more serotonin, because it's a sort of a feel-good hormone. It regulates your mood, helps you sleep. And so that's how those medications can help. But one of the most common side effects of that, like I mentioned, is digestive issues. And so the longer people have been on an SSRI, the more digestive issues they'll start having, because the most, the receptor is abundant in our gut. So yeah, there's a big connection between the two. And like I said, I do a whole other workshop just on that topic. But there is a strong connection. It goes both ways. And there's a lot to say about it, but I think it's very important to have that discussion. And it's very important to make sure people are aware of it.
So what are your thoughts about ketogenic diet?
Ooh, I have lots of opinions about lots of things. So the ketogenic diet, again, it's like the intermittent fasting where I said that it can certainly help people. I know patients that it has helped. They swear by it. I've seen their symptoms and their blood work improve. I've also seen patients who've had increased cholesterol, increased triglycerides, and increased cardiovascular problems from having done it. So it goes both ways. It depends on the individual. If you have a problem to begin with, where your body is unable to process and manage, triglyceride levels in your body easily, if you just keep dumping fat into that body, you're going to have problems. So a ketogenic diet is where you have barely any carbohydrates and you have higher fat and more protein. So these are the people who will happily cook bacon in butter and things like that and eat it, or cook their eggs in bacon fat. Like I said, I've seen a lot of people this has helped. Not ones who had full-blown diabetes for a very long time, because sometimes by then it's been a chronic condition. But I'm sure there are some it has helped. But ones I have seen, it hasn't. Also understand the people that come to me because it's a problem. So it's not like the best, sample of people
That's right.
in society, because I see people because they have problems. But yeah, that's what I would say. If you have diabetes or pre-diabetic, I've heard that it can help a lot because it reduces the amount of carbohydrates that you have in your diet, and that can certainly help your insulin management in your body. So that can happen. It depends on whether it's type 1 diabetes or type 2 diabetes as well. I have some people it has helped with cardiovascular issues and weight loss, certainly. But like I said, I also have people who've had cardiovascular things prop up because they after they started the diet. It's not that it was the cause, but it certainly started a few months after they started the diet. And I've helped them walk that back. So yeah, ketogenic diet, again, any type of diet you ask me about, vegan, gluten-free, ketogenic, intermittent fasting, whatever you ask me about for all of these diets, my thing will be the same. It depends on who's doing it.
Okay.
I couldn't do a vegan diet. Okay. It was not healthy for me because of the number of food allergies I have. I'm allergic to almost every vegan protein that was out there that's usually used to make vegan foods. So vegan diet didn't work for me. So it completely depends.
Thank you. Can you briefly talk about millets?
About what?
Millets.
Oh, millets.
Yeah.
MILLETS?
That is correct.
Yes. So millets are something that have really gained popularity in India. The last time I went there, I noticed that there were millets everywhere. And I think it's just because gluten-free options. sort of started skyrocketing all over the world. This concept of needing to go gluten-free became popular, and those are, gluten-free grains. And so they became popular, instead of trying to make, in the US here, you get things like Bob's one-to-one baking flour, or you get all of these other gluten-free flours. Instead of doing that, people suggested millets are by themselves gluten-free. Why don't you use those instead? So that's the reason I think they've gained popularity, especially in the last 3 or 4 years. They're healthy, certainly. I mean, any type of variety you can include in your diet is always going to be a good thing. So as long as you have no problem digesting it, you aren't having any problems with that, certainly include it in your diet. We do idlis and stuff like that with ragi, which is finger millet. So there are certain things we use it for. Just I haven't used it as much personally, but I do know that there are many things you can use it for.
Thank you. Can you please clarify whether insulin is released in the bloodstream or in the small intestine?
It's in the digestive process. And no, wait, hold on. Insulin is not released in the digestive system. It's released during the process, but it's in your blood because it helps. What insulin does is acts like a key to open the cell up so that glucose can go into the cell and be used as fuel. That's what insulin does. And so these cells are all over your body. It can be, whatever cell requires the fuel. Now, what happens in insulin resistance is that the key can't fit into the lock very well. So your body keeps putting more and more insulin, more and more keys to see if that lock can open. That's why you have higher insulin in type 2 diabetes and insulin resistance. But the glucose is still not getting into the cell because that lock is not functioning properly. So yeah, insulin is produced in your body. It's important to get glucose into the cell within your entire body. So it's not within the digestive system. Insulin is a part of something that's produced by the pancreas. So it sort of gets dumped in there. But the digestive juices get dumped in from the pancreas into the digestive system. But insulin is something that impacts your body overall.
Here's another one. I've heard tomatoes may not be optimum for those with osteoarthritis. Your thoughts, please.
That's very specific. So I haven't heard that one.
Okay, that's okay.
So I'm trying to think why that would be a problem, but I'm not sure about that one. If whoever it is asked me, please email me and I'll try and read about it and get back to you.
Thank you, Akshata.
Yeah.
Does stinky poo mean bad bacteria for someone who's regular and never suffers from constipation?
It can mean a few things. If you have, so here is something. When I was a kid, my family used to, on purpose, talk about digestive things. Certain people in my family used to talk about pooping and all of these things while I was eating just to gross me out, right? Because that's what family does. And I've grown up into a profession where I talk to people about every aspect of their digestive system on a daily basis. So that's interesting. But anyway, the stinky poop and foul smelling gas both indicate that you're not digesting your protein very well. Because protein has a lot of sulfur in it. And so when it isn't digesting properly, it essentially starts rotting is too drastic a word, but it starts doing that. And so that's why you get the bad smell from that, the hydrogen sulfide and things like that. Yes, having the wrong bacteria in your gut can also be a reason that you are having the stinky poop as well as foul smelling gas. Those are the two main reasons. Yeah, and for protein digestion, if you do have that issue, it would be that whole low stomach acid problem. So, you might have reflux, you may not. You might have constipation, you may not. But if you do feel uncomfortable after you eat, even 30-40 minutes, like it's not going anywhere, those are indications that you have some type of protein digestion problem. So, trying to support yourself that way in that particular thing will help.
Okay. Yeah. Is periodic munching small amounts of food, good or bad?
That depends on what you're munching on.
That's a good one.
Yeah, I've learned over the past decade that the minute I make statements where if I'm not specific, I used to tell, for example, I used to tell people have a handful of nuts. Well, it depends on your hand, right?
Yeah, yeah,
And
yeah.
whether you're piling it up or not. So
Right,
it's
right.
similar here, what is munching a bad thing? It depends on what you're munching on. Also making sure that at the end of the day, if you don't want to gain weight, there is a certain number of calories you need to eat. There are a certain number of calories you need to burn. So in that sense, you need to make sure you're not going over your calorie limit, because then you do start gaining weight. When you do start gaining weight, you have the abdominal weight that comes in. Fat around your abdomen is never a good thing for your health. So that's one thing in there. The second thing is what you're munching on. If you're mostly going for, things like maybe a few crackers and cheese, a few nuts, fruit and nut butter, raw veggies and a dip. So if you're going for things that are along a healthier spectrum of food, you can have a little bit between your your three meals, breakfast, lunch, dinner. You can have a couple of snacks. But if you're somebody who prefers to like graze all day long rather than eating meals, my questions would be, why do you prefer that? Is it because if you eat more than that, you don't feel good? If that's the case, that needs to be addressed. So what is the reason why you would rather graze than eat your meals and have a couple of snacks? Like that would be my main question back to this person.
Okay.
But yeah, otherwise it's mostly what you eating and how much of it are you eating.
Okay. You touched on abdominal fat. So this is not a question from there. Do you have a solution for belly fat, how to dissolve it?
Yeah, basically there are a few things that come into play here. I wish losing weight was as simple as calories in, calories out.
Mm.
And for some people it can be, but for many others it's not. And for women especially, it can be difficult because in addition to all of the other things, we have our own fun monthly, hormonal cycles we go through that can affect us quite a bit. So when you have to address abdominal fat, belly fat, it is important to basically step back and look at your diet. Even if you don't count calories on a regular basis, it's important to get an idea of how many you should be eating in a day and get an idea of what that looks like. So what I do with my clients usually is about 2 or 3 weeks, I tell them to pay more attention to what they're eating and writing it down. So you get a idea of what, if you need 1300 calories, what does that look like? And writing it down for a few weeks helps you say, okay, fine, this is how much I can eat at this meal. It doesn't have to be exact. You can be up and down 50, 100 calories, whatever, but you're getting a rough estimate. So it's important. The calories do matter. If you have to lose weight, unfortunately, calories do matter. It's not the only thing. The second thing that becomes important is hormones. What are your hormones doing? For women, estrogen, progesterone, what's happening with them? Are you in, perimenopause, just starting your period? What's going on? Those types of things matter. For men, testosterone and a lot of other things also come into play. So how your hormones are doing. So again, looking at symptoms, my intake form in my clinic is essentially 10 sheets of lists of symptoms. And you tell me when you have it, how often you have it, how bad it is. And looking at that, it helps me sort of figure out hormonal issues. It helps me figure out digestive issues. It helps me figure out blood sugar management and multiple different things, right? So looking at that, at the bigger picture, becomes important because it's not just calories. Your hormones play a role, your diet plays a role, your lifestyle plays a role, what you're exposed to on a daily basis plays a role as well. So looking at all of that and then into doing a good exercise routine depending on the person's fitness level. If you can do a mix of cardio and strength, that's important. But again, it depends. The type of exercises I recommend usually depends on the individual and if they're seeing like a physical therapist for any reason, or if they have joint issues and stuff like that. My husband's a chiropractor, so we talk about it and find the best exercise routine that could work for the person.
Okay.
Yeah.
Thank you. Can you comment on reseeding syndrome? I don't know if that's, you might understand this, post-recovery from hospitalization. So can you comment on reseeding syndrome, post-recovery from hospital?
Reseeding, I will need some help with from whoever posted this, because is that the idea of just using probiotics? Because I don't know the words.
Okay.
I'm not sure. So if they can put it in the chat about what they meant, I'll be happy to talk about it.
Okay. This is another one, medical term, so I'm sure you'll understand. What's your opinion about saccharom teas versus live bacteria for someone with IBS and the risk of acquiring fungal systemic infection?
So I would suggest, it depends on the type of probiotic that's being used, and that's what that is, right? So Saccharomyces is a type of yeast, which is a good one to have in your body. But some people are very sensitive to how that functions, and some people are sensitive to the type of probiotics that can have it in it. So I think it becomes important to look at the type of probiotic you're taking, the dosage of it, and also making sure if you have like a systemic fungal thing, usually comes around because of antibiotics, like if you've been, or strong medication that you've been on. That basically causes a wipeout of your gut. When you take antibiotics, it doesn't go and find only the bad bacteria or the bad organism that's causing havoc in your body. It wipes everything out, right? And so if you've been on medications that can affect the microbes in your gut, if you've been on antibiotics, strong ones, then that can cause like a cleaning out of your system, and then fungus can sort of take hold. Candida and a lot of these other bad fungi can definitely start getting introduced, and your body can't fight it off as well because it doesn't have the good guys to take up space. Essentially in our gut, what happens is, as long as the good guys are taking up space, even if the bad guys are there, they can't take over. But if the good guys go down just enough, the bad guys will take over. So that's basically, they're just waiting always. It's opportunistic. They're constantly waiting what will happen and how can we take over the system. And so for somebody who has that sensitivity or the ability for that to happen, it will definitely take way more information from their end for me to really suggest anything, because I have to be careful if that's something that they have an issue or have had an issue with or are worried about it. I don't want to just sort of make big statements, but looking at the type of probiotic, dosage, why you need it, and what caused any type of fungal issue in the first place, those would be important pieces of information for me.
Can you, this is a question, is irregular bowel syndrome curable?
Yeah, I mean, it depends on, I would like to say yes, absolutely. But I think it depends on how long a person has had it. Because there are some things that just impact your body over a period of time so much that it won't bounce back to what it was. I like to say that your health is like a rubber band. You can keep stretching it, it'll come back, you stretch it, it'll come back. After a point of time, when you stretch it beyond a certain thing, it may not go back to its original state, it could get better, right? So that's, it's just something to keep in mind. A lot of these things are things that can be addressed through diet, through lifestyle, or other interventions that are required. But it really and truly depends on how long you've had a particular problem. If it's something that's new, just a couple of years or something like that, the chances of you feeling like your former self are higher. But if it's something that's gone on for a long time, it just keeps reducing the chances more and more of that happening.
Can you explain a little bit about probiotics versus prebiotics?
Yes, so probiotics are the bacteria you have. Prebiotics are the foods that feed them. So you'll see in a lot of new probiotic supplements where previously it used to just be a dump of bacteria, or in some cases, Saccharomyces, the yeast I was talking about for that person who asked about the fungal thing. It depends on, before they used to have just those. Now they have that combined with prebiotics in them. So there are certain components of food that help the good guys survive. Fiber is a big thing. So eating a diet rich in fiber really helps the good bacteria in your gut. So all of that now gets combined into a probiotic supplement, and that's what you take. Good sources of prebiotics are actually like onions, garlic, asparagus. They all have things in them that can really support the good bacteria. And like I said, high fiber foods are always a good idea as well. So that's the difference. One is the bacteria itself, the other one is the food that supports them.
Your thoughts on gluten allergies?
My thoughts are that it exists. Certainly, I can't have gluten in my diet, but I also know that there is no reason for everybody to avoid it. Like the gluten-free fad was fantastic for me because it meant that now I can get cookies that don't taste like cardboard, which is nice. It means I can bake again at home, which is nice. It just, the demand made it that people put money in, invested money to come up with better options. So I'm very grateful for that. But unfortunately, it also means that it's created this whole sort of system where people believe that if gluten is toxic, and that's not the case. It really depends on you. The best way you can find out if you are reactive to it, because for a lot of people, if you've been eating a food for a long time, it is difficult for you to know if you react to it or not. The best way to know if you do is take it out of your diet for 2 or 3 weeks, add it in again, see how you feel. Usually 2 to 3 weeks is enough of a time to allow your body to calm down and not be as hyper if it is. And that way, when you eat the food again, you'll get a more clear signal if something's wrong.
As, as a diabetic, the suggestion has been to reduce my fruit intake. Your thoughts if I'm missing out on nutrients by avoiding fruits completely?
I think that the type of fruit matters. There are certain ones that can be higher in sugar content. I have to start out by saying I don't know how bad the diabetes is, or how chronic and how long it's been for this person who has diabetes, because that does impact what's going on and if it's type 1 or type 2 diabetes. But yes, the type of fruit I think can make a difference. You want to try and reduce things like bananas and apples, unless you can eat that a smaller amount with like a nut butter or something that has a little bit of fiber and protein in it, because it changes the way your body absorbs the sugar at that point. So, you can certainly still eat particular fruits. You just combine it with other things. So it's not just the fruit you're eating. But things like raspberries and, berries especially are high in fiber, and they are very high in nutrients and lower in sugar. So it shouldn't have as much of an impact on blood sugar as some other fruits can. So I think, apples, pears, bananas, those are things, grapes, those are things you want to be careful about. But there are plenty of other fruits that you could possibly eat. Again, I have to say, I don't know this particular person's specific case, but in general, that would be what I say.
Okay. Is it okay to just survive on fruits and veggies, meaning take out all the rest of them?
Yeah, I mean, that's, well, fruits and veggies with like no lentils, no beans, legumes, that would be tough. But otherwise, essentially, that's a vegan diet, right? Without meat and things in it. And now they've come out with a vegan diet, a paleo vegan diet. So that's, I have to look into that. But anyway, I think you'll be missing out on a lot if you're just doing truly just fruits and vegetables. They are great for you, but you get a ton of other nutrients from a lot of other fruits. And if you don't need it, I don't understand why your diet needs to be restricted. If you don't need it to be restricted for a medical reason or for a health reason, I don't see why anyone would restrict their diet, because food is awesome.
Right. So here's a one in terms of irrigation. I just had a virtual event on climate action and climate change where we spoke about regenerative agriculture. But here it is. The question is colonic irrigation therapy beneficial?
Oh, well, this is very different from the irrigation you probably talked about in your climate change thing, because colonic irrigation is very individual. Now, colonic irrigation, the thing with that is, if not done properly, it can cause a lot of damage to your body. Basically, you are, irrigating your colon with things that would not normally go in that direction in your body. That's one thing. And also what you're irrigating it with. There are people who do like coffee enemas and so many other things, and I don't always understand that. There are people who believe that you can introduce probiotics into your gut that way. I just think that the problem that's come out of this, and I'm sure there are people who can do it properly and safely, but the problem has become that it became a part of this whole wellness scheme, and all these people who are sort of talking about just like wellness gurus without the educational background for it. So that's where I think the problem has come in, because now there are people who claim you can do it at home or go to all of these places that can do it where they probably aren't trained to do it properly. And so then you can have perforation of your colon, you're introducing stuff into your system that wasn't there, and that's always a scary thing to do. So I think that there are problems that can come from it if not done properly, and I don't easily know or have like a website to say you can go here and these are the practitioners you can go to and trust. Like I don't have that information. So in general, I just recommend people that, if you have these problems, what are the problems? Why do you think you need it? Let's see if there's some other way it can be addressed. And if not, I would recommend them back to their doctor rather than something like that. Another thing about probiotics being introduced, they have done therapy where you can have, but that's like a medical procedure where colonic flora is moved from one person to another. Like that's been done. And now you can actually get pills for that. So those types of things are certainly happening, but nothing is sort of mainstream enough right now to really say yes or no about it.
Should diabetic pills be taken before or after meals?
I think that depends on the medication, and you have to follow the pharmacy and doctor recommendations very closely for that, because some are required after you take a medication, some are long lasting, long release or whatever that's called, and some act immediately. So that I think I can't say much about that. It depends on the medication, and you have to very closely follow whatever is recommended by the pharmacist and doctor.
So we are almost at the end. The
Yeah.
last question: will gluten-free diet help the hyperthyroidism to cure better and faster?
Um, so the thing with gluten and thyroid, there is a connection, because if you have a problem where your body is attacking your thyroid, it can attack a portion of the gluten protein as well. Or if you have a gluten sensitivity in the converse, it can attack parts of your thyroid as well. There is some sort of an overlap there that can happen for some people. But usually that results in hypothyroidism, not hyper. So gluten-free diet. Now, again, someone who has either hypo or hypothyroidism, to reach that point, your body is going through something. So it becomes important to understand overall what it is. So gluten might play a role, gluten may not. That becomes understanding more of what the individual has going on rather than being able to say, yes, it will or no, it won't. For some people, I know some people that it has helped, and I know some people that gluten made zero difference. So
what kind of diet is best to address fatty liver condition?
You want to try and basically, and I'm guessing this is, I'm assuming, not guessing, I'm assuming this is non-alcoholic fatty liver. So it's not because of alcohol abuse. That's what I'm going to talk about right now. So anytime you eat something during your day, if you eat extra carbohydrates, your body converts it to fat. And the closest place it can find to deposit it is around our abdominal area and region. So you want to try and look at your diet and make sure, if you're somebody who snacks often on processed foods, that's something that you want to try and avoid, because you want to try and reduce these simple processed carbohydrates. It'll help because there isn't extra of it to get converted fat in our body. Once the sugar goes to fat, turning it back is, yeah, that's not going to happen. So that's our problem is, we're very easily convert sugar to fat, but it's way more, difficult to go the other way around. It takes way more effort. Our body converts things to fat because it's the most efficient form of storage of energy. So our body is just trying to get the most bang for its buck, but it can have these side effects. So trying to reduce your carbohydrates is going to be very important. Simple carbohydrates, processed foods will be important if you have fatty liver disease. And then also making sure you have a good exercise routine if it's possible for you. If it's not, what else can you do to help your, sort of, if it can't be cardio exercise or whatever, like what fitness level do you have so you can maintain an exercise routine?
Thank you. The last question, or the final one, you'll be happy to hear. I'm not sure if people know you're from Vermont, but they want to know, do they need a referral to become your client?
Oh, well, given that I don't accept insurance, come one, come all. So there is no, it's basically because I don't accept insurance for my appointments. My options were to accept insurance and do 15-minute appointments, or not accept it and be able to do the hour and a half that I require, that I think I require, and I know I require.
Okay.
So yeah, because I don't accept insurance, no referral is required. The only place we accept insurance in our clinic is for chiropractic. So if anybody's from Vermont, then yes, you will need a referral to come see us for chiropractic, but for nutrition, you don't.
Okay. Okay. So I'm done. Thank you again for speaking nonstop. We appreciate it.
I don't, it's, after a point of time, you start really wondering why your voice sounds like that. So I hope that hasn't happened to others. But thank you very much for listening, all of you.
Question, if I can ask.
I drank so many times water. I'm gonna pass it on to Sadanand. But thank you, Akshata.
Yeah.
Thank you very much. I thought you were going to pass water on to me, but thank you. Thank you. It's a wonderful presentation, as most of the people have indicated on chat. Akshata, thank you for making such a complex subject not only simple, very interesting. On a personal level, I have a strong feeling that I will be feeling your presence in my home. There will be a lot of finger wagging, or even telling, if you don't believe me, at least remember what Akshata told you. Thank you for that. And again, as Sureka said, sparing all that 2 hours now and other day, half an hour getting prepared, all these emails, etc. You have been extremely kind.
Oh, thank you.
And one thing is for sure, we would like to keep in touch with you.
Absolutely.
As you had said, if anybody has any questions or something, they can send an email to you.
Yeah.
Thank you again. Before I close, I just wanted to draw the attention to the future events. On May 2nd, we are going to have a very interesting information session. It will be on estates, will, trust, executors, power of attorney, etc. And 2 highly qualified, experienced speakers from the Attorney General's Ministry of Attorney General have agreed to be with us. So I do hope all of you will come and encourage other friends and relatives to attend. Then on July 25th, we are going to have another interesting information session that will be on retirement living, the independent living, assisted living, home care, as well as long-term. There too, we will have some experienced, qualified speakers do plan on attending. In addition to that, we will be planning some sessions on fall prevention, osteoporosis, and Alzheimer's, first aid and seniors, etc. So I will be keeping you all informed on a timely basis. I was so happy to see over close to 70 people attended at any given time. Once again, thank you all. And I know it is daylight savings time. You have already lost an hour. I don't want to make you lose any more. Thank you again. Bye.